Hey guys, it is Queen Osaharu. It's your girl coming to you from Costa Rica, and I wanted to give you a little chat today about something that's actually kind of important. Okay, so I've been hearing a lot of people lately talk about depression, mental health issues, depression, anxiety, things along those lines have become more and more talked about over the past like decade, which is really good because it needs to be addressed. Now, this is the thing. I could probably do an hour long video talking about depression, signs, warning signs, all kinds of stuff. But what I wanted to talk about today, and I might do those things later, is talk about dealing with depression. Because I think that everybody talks about what it is, what it isn't, how to diagnose it, all kinds of stuff. But nobody ever really tells you how to deal with it, how to fix it. Now, depression to me and mental health issues in general are just like physical ailments. If somebody came to me and said, "Hey, I have diabetes," I would say, "How are you treating it? Are you losing weight? Are you exercising? Are you taking medicine? Or do you need insulin? Like, how are you treating it?" If somebody told me that they had cancer, I would say, "Are you seeing an oncologist? How are you treating it?" It's the same question with depression. But when you ask people about depression, they're not treating it. It's like some of them have even been diagnosed. Some of them will tell me, "Yeah, my doctor said I have situational depression, or I'm bipolar, or I'm this, or I'm that." And I'm like, "Okay, all right, you got a diagnosis. So how are you treating your illness?" And that's where it stops at. People get diagnoses but don't treat the illness. Or sometimes they try to treat it, but they can't find a way to cure it, so to speak. And then they just kind of give up or they don't work on it at all. And doctors and medical health professionals will say things like, "Okay, try this medicine, or try this talk therapy, or try this art therapy, or try this or try that." But people are just like, what I've come to find, just living with it. They're not treating it at all. You wouldn't have diabetes and just not treat it. You wouldn't have, any other disease and just not treat it unless you have a death wish. Most people would treat their illness, but not with depression. People don't address it. They don't treat it. They don't think about it. They know it. They might talk about it, and that's really it. And what I'm here to tell you is that that is a big mistake. Depression left untreated continues to be depression, and I guess it turns into what they would call chronic depression. If you have to think about depression kind of like quicksand. The longer you stand in the quicksand, the further you sink. And that's how depression is. The longer you stay in it, the further you sink and the harder it is to get out of it. For most of us, depression comes in one or two ways. It comes forward as a side effect of some kind of chemical, hormonal, mental imbalance, or it comes about because of trauma, because of traumas that may have caused, other mental health issues. So we have trauma, or we have, being born without the right hormonal chemical mix. Either way, you have to treat it. You have to figure out which one it is, get your diagnosis, and then you have to treat it. How do you treat it? There's lots of ways to treat depression. You have an emotional health issue. Now, if it's chemical, hormonal, and it's something that's in your physical body, typically those types of people may do well with medication. They may do well with a different diet. They may do well with exercise. There's so many different things you can do, especially when it's chemical, that you can, but you have to figure out what works for you. You can't just not treat it. You have to try different things and figure out what helps you. And you have to try it for a while. You can't just try it for a couple of days and then be like, "Okay, well, my depression treatment didn't work." Well, you only tried that for a week, dog. Like, come on. You got to give it, some time, months, 6 months. You got to work on it. Now, if your depression is caused by situational depression, like mine was, just things happening to you in your life that you have not dealt with, have not gotten over, have not released, have not healed, whatever the words are for it, you have to heal it. Period. You have to figure out what it is. It may be more than one trauma, and you have to do whatever you have to do to heal it. There are spiritual methods. I have used crystals. I have used Reiki. I have used heart chakra meditations. I have did talk therapy. Talk therapy was great. I did that for like 18 months. There are lots of different ways to heal it, but the bottom line is that you have to figure out what that trauma is, and you have to work on it. You have to work on healing it, forgiving it, and releasing it. And this is easier said than done. I'm not going to stand here and tell you, oh, you're going to work on it for a couple of days. It's going to take a while. I started working on my own inner wounds when I was like, must have been like 18 years old, and I think I was done by the time I was like 36. You know, the more you have, the longer it's going to take, you know, and the more stubborn you are, the longer it might even take. So you have to figure out what those wounds are and start to heal them, start to address them. You cannot just say, oh, I have depression, and just sit there with the depression like it's your pet. You have to deal with it. You have to deal with it. You have to heal it. You have to release it. You have to work on it. And it's a day-to-day thing. And then what happens is that after you've dealt with it, after you've done the work on it, you slowly feel yourself getting happy. And it's kind of weird because you're not used to being happy. So you're like, what's that feeling, you know? And you just, after a while, you feel happier and happier. You work on yourself. You better yourself. You get yourself wherever you want to be career-wise, you know, and you just keep on working on yourself. And one day you look around and you're like, I'm happy. You finally one day look around and say, you know, nothing's perfect. Life is never going to be perfect, but I'm happy. I'm happy with what I am. I'm happy with where I am. I'm happy with what I have. I'm happy. This is good. And your depression has lifted. You're out of that quicksand. And then if it was situational depression that came about from trauma that you've been able to heal, from that point on, you'll use your coping mechanisms and you'll deal with trauma as it happens. You won't let it keep on, you know, piling up on you like that, and you'll keep on moving forward. If it's a chemical thing, you'll work with your medicines, you'll work with your doctors. But the point is that you have to research the different types of treatments are out there, and you have to try the ones you feel comfortable with trying. If you don't take anything else away from this video, take from it that depression is not something that's going to go away because you ignore it. It's actually probably going to get worse. You have to figure out what's causing it, and you have to treat it. You have to heal it, or you're going to sink lower and lower and lower and lower. And believe me, I suffered from depression for a very long time and did not do anything about it for a very long time. I didn't even realize I could do anything about it for a very long time. But when I finally got tired of it, I got tired of crying all the time. I got tired of coming home from work and crying. Every day, go to work, come home, cry. Go to work, come home, cry. I got tired of it. I got tired of feeling empty. I got tired of hurting. I got tired of it. And I was like, you know what? There's people who aren't feeling this way. So what is going on with them? What are they doing? You know? And I started to research, and I started to look at emotional healing techniques of, you know, spiritual kinds, because I'm into spirituality, I'm into ritual, I'm into meditation, I'm into that kind of thing. So I looked at there first. I looked at therapy. I got self-help books. I used Ayan Levon Zant's books. I used Louise Hay. She has a lot of books. I used a lot of stuff from Hay House. I looked at different authors who had information about depression. I looked at different authors who had information about emotional healing methods, and I used their work. I used all these things, and I did these things day after day after day, and I kept on climbing. I kept on working on it. And yes, it took me a very long time because yes, I had a lot of stuff to heal. I had trauma all the way down to when I was 2. My father left home when I was 2, and I never really kind of got past it. I kind of dealt with it, but I kind of didn't. You know, it's kind of like, you know, I compartmentalized it. I kind of separated, I detached from it, and just kind of pushed him into a drawer somewhere and didn't think about it. But that's not how you heal something. So the thing about it is that it depends on how much trauma you actually have in the depression. If it's one situation, it may be a little bit easier than others. It just depends. It depends on what happened. It depends on a number of different factors. Every case is going to be a little bit different. But the one thing that's the same in all these cases is that it has to be addressed. And there's the one thing that I do not see enough of. I see too many women, men too. I see too many of my sisters. Um, I see too much pain. I see pain, and men are different than women because the way it comes out is different. When men are depressed or when they're hurt, it comes off as a lot of times toxic masculinity, which is not good for the community, which is not good for any of us. And women, on the other hand, some of the times they go into, toxic femininity, or even other things can even occur, such as just detaching from their own family, their own children, their own lives. Either way, it's not a good thing. So please, as you're watching the video, the one thing I want you to take from this is that if you are suffering from depression or know somebody who is, please encourage them to get treatment. Encourage them to research the different kinds of treatment. Encourage them to look and see what can help them. Encourage them to get a diagnosis, to see a mental health expert. Encourage them to start doing things to bring themselves out of this quicksand, to dig themselves out of the hole, because the hole is only going to get bigger. So please encourage the treatment of depression. I see everybody talking about depression, but I don't see people talking enough about how to heal it. So please, if you're feeling depressed, if you know somebody who's depressed, please, if you want me to give you some of the methods that I've used, I'll tell you right now. On YouTube, right where you're at right now, there is something called heart chakra meditations. There are heart chakra Reiki is another YouTube videos they have. Those videos are really good at starting to heal the heart chakra. My favorite crystal right here is one of my favorites is green aventurine, is to heal the heart chakra. Those are the two methods that I use myself. There's also, like I said, talk therapy was a big help. I really recommend it. I also recommend self-help books. Those are some of the ones that I've been able to utilize. Like I said, Ayanna Van Zandt has some really good ones. I love her books. And Louise Hay has a book called You Can Heal Your Life. And it comes with a companion workbook called the Love Yourself Workbook. Whenever I work with clients, I usually give them some self-help books to actually read, because it will help a lot in your understanding of what's happening to you. So this is what I encourage, and if you have questions or you have comments, please leave them underneath the video, and I'll answer and address anything that I can help you guys with. So please think about that. Depression it can kill you, literally. The pain it can kill you. Not the pain itself, but your response to the pain. And if it doesn't kill you physically, it can kill you spiritually. You'll be dead, the walking dead, as I call it. And you don't have to live like that. I'm living proof that you can heal depression. You can. You can heal depression. You can heal yourself, but you have to work on it. Okay? Take care, guys.